link between nutrition and certain arthritic conditions? Should we be staying away from certain foods?
There's now it's being developed and it's being researched at the moment. There's a very strong link between the gut and arthritis, inflammatory arthritis.
Right.
So what happens is that there's some dysregulation in the gut. There's more bacteria in the gut, which sets off this whole systemic thing. But it's all still in its infancy in terms of it's still being researched. But there is a link between inflammation in the gut and arthritis.
So previous times you've appeared on Medical Monday, we've spoken about many conditions, and we've always kind of relegated gout towards the tail end of the show, and we only managed to swing a minute or two. So I want to start off with gout. Someone mentioned to me earlier on today in an email, make sure you ask Dr. Maharaj about gout and how one could lower their uric acid levels.
That's right.
Naturally, so by staying away from certain type of food. So let's get into that straight off the bat. If someone has gout and they come and see you, apart from the treatment option that you offer them medically, from a nutrition perspective, what advice would you give someone regarding gout and their diet?
Gout is very important. Gout is one of those diseases or one of those types of arthritis that is directly related to diet. Okay. There are types of gout, but let's concentrate on the ones that occur with dietary related. Now, gout is often said to be the disease of kings and the king of diseases.
King Henry, didn't he famously have gout?
Yes, King Henry had gout. So whatever you take in can result, if you have a lifestyle that's excessive in red meat, in alcohol, all of those things increase your risk for the development of gout. So if you have a high uric acid and you present with an acute attack of gout to your doctor, on first presentation, we do not treat patients on first presentation. Okay. So we try and identify what the risk factors are. We try and identify what the level of the patient's uric acid is, and try and modify the diet in terms of red meat, in terms of alcohol, shellfish, all of those things, Marmite, caviar. They refrain from all of those things completely. There's complete abstention from all of these things. And then we put patients on an exercise program, lose weight, control their diabetes if they have diabetes and hypertension. Some of the medications we use for treatment of high blood pressure or hypertension can increase the risk for gout.
Right. Okay.
So all of these things, the patient has to be taken in totality and looked at in totality.
Is there any family of hypertensive drugs that may increase your risk for gout?
Yes, the thiazide diuretics. It's called water tablets. People commonly say water tablets. So the thiazide diuretics are the culprits for increasing the uric acid in hypertensive patients.
Okay, and also you're saying lower your amount of
purine-rich foods,
right?
Whatever your purine-rich foods is, try and lower that.
Can it be successfully treated once you manage your diet and you're on the medication? Can you
Absolutely.
say, well, that's it, my days of gout are over?
If the patients have 3 or more attacks of gout a year, then we go in and start treatment. If we can control them on dietary measures alone, then we don't need to put them on treatment.
There was a story, I think maybe 3 or 4 years back, that I read on my health headline that quoted a study regarding those who drink coffee and the lower incidence of gout, from those coffee drinkers. Have you heard of any correlation between the amount of coffee you're drinking and your incidence of?
I haven't heard of that study.
Maybe something that
we can look at.
Yeah. It's creeping up to 7:30.
Shall we have that over coffee? Discuss it over coffee.
I don't drink coffee, but listen, I can sit and talk to you anytime, Dr. Maharaj. Maybe we can talk in your Maserati one of the days. You've been promising me a driving. All right, let's go to WhatsApp.